Hello guys, today I want to talk about chapter 1. Chapter 1 we talk about exercise science. Exercise science is all about exercise science. They have 5 elements of exercise science. Element divide to 5 elements. One is psychology. Psychology is the development of motor behavior and exercise and sport psychology. That's one. Second is about physics. Physics is about expanding the mechanics of movement, biomechanics. Much like study movement. Contoh sepak bola, like you kick the ball. When you kick the ball, you have to put your foot beside the ball. You have to senyekkan badan. Macam mana senyek? You have to hayun kaki. And the third one, biology and chemistry. Biology and chemistry is like exercise physiology. Physiology. And fourth is sport nutrition. Sport nutrition is that pyramid makanan. Food pyramid, fat. Pyramid. We have to fat, carbohydrate, protein, and that. And lastly is about historical and social context. That's all from me.
Hello, Assalamualaikum. Okay, my name is Amir Fizabi Ambar. My matric number is 2020863802. So I am gonna present about okay, my part, which is the chapter 2, introduction to exercise physiology. So what is physical fitness? Physical fitness, as a example, is for muscular strength and endurance, flexibility, body composition, power, cardiorespiratory endurance, and agility attributes, which is related to how well one performs physical activity. Okay, so as the definition is the study of how the body, which is the cell, tissue, organ or system, respond in function and structure to acute exercises, stress, and chronic physical activity. As an academic discipline, so for the first is body of knowledge built on facts and theories derived from research. Okay, secondly is the formal course of study in an institution of higher learning. Okay, and third is the professional preparation for practitioners, future investigators, and leaders in the field. Okay, what is exercise training? Exercise training is the repeated uses of exercise to improve physical fitness. So is an adaptation of exercise acutes and adaptation of the changes in human physiology that occur during exercise or physical activity. So okay, the application of exercise physiology to other disciplines and profession cardiology application. Okay, first is biochemistry. So as example is a metabolic adaptation to muscle. It helps in metabolic adaptation to muscle contraction exercise training. Okay, secondly is cardiology, which is helps in diagnostic, rehabilitation, and prevention reversal of risk factors for heart disease. So next is endocrinology, which is rehabilitation of types diabetes. Okay, physical therapy, which is for injury prevention, and last but not least is for pulmonology, which is a training or a conditioning of muscle uses in ventilation.
Assalamualaikum warahmatullahi wabarakatuh. My name is Raisa Kabirosli, and now I'm going to tell you guys what you guys should know about the topic 3 of Introduction to Kinesiology, which is general health and benefit of exercise. Okay, for introduction, exercise can improve physical health optimally, and when you done it continuously, it will help you to avoid being exposed to the modern chronic disease. Besides, Exercise also can be a factor to recovery from illness. Okay, the modern chronic disease that can be dangerous is heart disease, angina threshold, heart attack, high blood pressure, hypertension, obesity, diabetes, and last osteoporosis. And assistance in recovery will first keep doing exercise, control food intake and energy expenditure. Number three, do diet and doing weight loss exercise. Number four, increase metabolic rate by doing exercise. Okay, next I will let my friend to continue the presentation.
Uh, I'm to present about chapter 4, which is human performance and biomechanic. Okay, biomechanic. Biomechanic is an involving about a study of biological system from a mechanical perspective. Okay, what does biomechanics do? So there's what we call many kinds of type that biomechanics to be, which is as an agronomist, okay, professor, researcher and clinical biomechanist. Okay, so okay, next is a concern on force on human body. There are two types, which is internal and external. Okay, the differences between kinematics and kinetics. Okay, kinematic is a motion including consideration space and time, while the kinetic is the determining causes of action. Okay, so as an example of kinematic is distance, which is been calculated in meter or kilometer, velocity or speed. So as example of kinetic is by using Newton's law, momentum, impulse, or initial concept. Okay, that's all.
Assalamualaikum, my name is Hamad Mikael bin Abdul Wahab and I'm going to talk about chapter 5 and chapter 6. First, I'm going to talk about chapter 5, which is Introduction to Sport and Exercise Psychology. The definition of sport psychology is the principle of psychology used in sport setting. Sport psychology helps athletes to achieve their goal, recover from injury, and gain confidence. Goals of sport psychologists is to understand the social psychological factor that influence people's behavior and performance. Next, to teach athletes technique that commonly used in sport psychology, such as mental imagery, relaxation, and goal settings. And the last one is from learning and practicing this technique, an athlete will have the ability to achieve their peak potential. Uh, Next is the personality studies. There's a study about relationship between personality and performance. In the study, it shows evidence that athletes in different sports has different personality. In general, athletes often exhibit higher levels of extroversion and lower levels of anxiety. Next, the inverted U theory. First, it's called inverted U theory because the shape of its curve predict the optimal performance require optimal level of arousal. If the arousal level is too low, performer is inadequately motivated or bored, while if the arousal level is too high, athlete will show sign of anxiety and their performance will suffer. Shape of inverted U curve is different for each individual. Some people will perform better when fully relaxed, while others might need a little more of motivation and arousal to perform better. Application of clinical sport psychology imagery approach can be divided into four theory. The first is psychoneuromuscular theory, symbolic learning theory, arousal theory, and bioinformational processing theory. Sport psychology in injury prevention and rehabilitation. Too much training can be physically stressful and result in a degradation in performance of athlete. Muscle may not have the chance to recover between training sessions. If this happens, athlete may manifest the staleness syndrome or the overtraining syndrome. Chapter 6, Motor Control and Learning. Concepts and principles of motor control focus on the neural, physical and behavioral aspect of human movement, understanding the execution of those processes that lead to skilled human movement as well as factors leading to the breakdown of such skills. Concept and principle of motor learning deals with motor control changes that occur as a consequences of adaptation and practice. It focuses on how motor skills are acquired or learned and the changes in performance, ability, and control mechanism. Modification in motor behavior or improvement in proficiency of a motor skills due to experience or practice condition. Type of motor skills: generic motor skills, which are skills that are readily available such as walking, running, or jumping. And the secondary motor skills, which are skills that we need to learn such as cycling or swimming. Ways to classify motor skills: identify skills characteristics that are similar, divided into two categories, which is the first one is the one-dimensional system and two-dimensional system. The one-dimensional classification system: size of primary muscles. Gross motor skills require large muscles and less precision move. Fine motor skills require small muscles and very precision movement. The second one is the specificity, where action begins or ends. Divided into three: discrete motor skills, simple movement or one movement skills. Continuous motor skills involve repetitive movement, while serial motor skills involve a series of discrete skills and the performer control the situation. The third one is the stability of the environmental context. Closed motor skills perform in a stable environment where performer determine when to begin the action. Open motor skills, a non-stable, unpredictable environment where an object determines when to begin the action. And two-dimensional classification system only have two, which is the first one, environmental context, open or closed, and the function of the action. Does the movement involve the body moving the body or not? Next is the fundamental movement skills. Fundamental movement skills are movement patterns that involve different body parts such as leg, arm, trunk, or head. Categories of fundamental movement skills divided into three. The first one is the body management skills, involve balancing the body while standing still and in motion. Locomotor skills involve transport of body in any direction. And object control skills require controlling implements such as bat or racket or objects either by hand or foot. Factors that influence the development of fundamental movement skills: the child, their age, physique, health, physical activities, interest and motivation to practice, and the environment, family, community and cultural values, expectation and support, and the opportunities to practice.
Chapter 7: Ergogenic aids. There are 5 types of ergogenic aids, such as nutritional aids, mechanical aids, psychological aids, physiological aids, and pharmacological aids. The first one is mechanical aids. It is a form of ergogenic aids, include specially designed clothing, enhanced form of sports equipment, and physical device in contact with a person's body. For pharmacological aids, the performance enhancing drugs, both illegal and legal. For physiological aids, is a natural substance like herbal tea, and things like acupuncture are physiological ergogenic aids and can be used to aid performance. For nutritional aids, can include anything from manipulation of fluid, carbohydrate, fat, and protein content in a diet, to nutrient or food supplements in the form of tablets, liquids, bars, injection, or powders. The use of sports drinks and carbohydrates have been shown to improve recovery and replacement sugars and electrolytes that are lost in exercise. For psychological aids, the techniques that support the athlete's mental state of psychological ergogenic aids and can aid performance. The type of techniques is hypnosis, cheering, and imagery. World Anti-Doping Agency. It is established in 1999. The activities that World Anti-Doping Agencies does is scientific research, education, development of anti-doping capacities, monitoring of the World Anti-Doping Code.